I think since I was little, I always wanted to be a doctor. And I was always aspired to do something and make a difference in life.
Dr. Ike Ahmed, who is one of the most experienced complex eye surgeons in the world, has been achieving groundbreaking work in the surgical treatment of glaucoma, a progressive and chronic disease with no cure, which is the second leading cause of blindness globally. Dr. Ahmed and his team are leading the charge within MIGS, or minimally invasive glaucoma surgery, the first significant breakthrough in glaucoma treatment in more than 20 years.
So glaucoma is a chronic condition of the eye. It's actually the leading cause of blindness in most parts of the world. It's slowly progressive, so there are no symptoms to this disease, unfortunately. And if not treated, it can cause blindness over time.
My vision is very important in my practice and in my life. I was 40 years old during my first diagnosis. I was pretty surprised because I did not have any member of my direct family that had glaucoma.
So in glaucoma, what happens is the pressure slowly builds up because of blockages inside the eye. This slow pressure increase causes damage to the back of the eye, the optic nerve, and the retina. Over time, this causes loss of peripheral vision. So first, the peripheral vision is lost. Again, it's usually very slow. Patients don't typically pick it up, but slowly over years it causes loss of the central vision. At that time, unfortunately, patients can have serious vision loss and it can affect their quality of life. So glaucoma can be treated, fortunately. We cannot cure the disease, but we can prevent serious vision loss by lowering pressure. Eye drops that we can give multiple times in the day can be used and have been used many times. We have laser approaches to enhance drainage through the natural system. And then we have more invasive surgeries to basically bypass the natural drainage system. Lately, we've been now using a lot of minimally invasive approaches, and this is a new genre of devices that I think provide further pressure lowering without some of the risk of more serious eye diseases and surgeries.
Eye drops are often the first choice for treating glaucoma.
Now, eye drops can be effective at lowering pressure. Unfortunately, over time, they often become ineffective. But the bigger challenge for our patients are two issues. One is compliance. It's hard for patients to remember to put drops in every day. When patients can't put drops in every day, then the disease gets worse. And the other are, of course, side effects. So redness, irritation, burning.
It's always a challenge to remember every night. Did I put the eye drops or not? So I tried my best.
So over the last 20 years, we've been searching for ways to better lower pressure without relying on compliance and eye drops and without taking serious risks of major surgery. This has led to the development of some of these microscopic options and microscopic devices. For example, the eye stent is the smallest stent and the smallest device placed in the human body. It's designed to naturally improve the outflow through your natural drainage system. And this progress has allowed us to provide options to patients that maybe aren't tolerating drops very well, drops aren't working, but maybe the disease is not so severe they don't need to have major surgery. And that's where, microinvasive glaucoma surgery, or MIGS, is born. I was very fortunate to be involved in this. I coined the term back about 10 years ago as an effort to really push forward the field in this interventional era of glaucoma, intervening earlier with a safer option while addressing issues around patient compliance and adherence.
I consulted with my ophthalmologist, and he strongly recommended that I do the glaucoma procedure and surgery with the cataract surgery in the same setting.
So one of the important hallmarks of MIGS for glaucoma surgery is to ensure we have safety. We have over 100 studies that have been published around the world, almost 500,000 implants that have been put in. And so I think the safety has been well established over the last 10 years. I think we can really hang our hat on the safety.
I have little stents in both of my eyes. They are made of titanium. I cannot feel them, and I'm very happy and excited not to have to take my eye drops every night.
Have a discussion with your eye care provider. If drops are a challenge, if they're difficult to put in, you're forgetting, then that's potentially a problem for you in terms of your risk of getting worse, and of course affecting your quality of life. We have options now. We have laser options. We have micro-invasive devices, like the eye stent, for example, that can be done fairly safely, lower pressure, reduce some of the side effects of drops. I like helping people, so it's incredible the effect we see. I am so lucky to do what I do. I don't look at it as a job, I look at it as a hobby. I'm thrilled every day to walk into my office or walk into surgery.
To learn more about recent treatment advances within glaucoma, please speak with your ophthalmologist.